Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go to reallifepharmacology.com, get your free 31-page PDF on the top 200 drugs. Great study guide, great refresher. If you're out in practice or whether you're a student, definitely a must-have, and simply an email will get you access to that. Absolutely no cost to you. So go take advantage of that, and we'll also get you updates when we've got new podcasts and other content available as well. All right, so the drug of the day today is clotrimazole, and the brand name of this medication, well, there are a bunch of different brand names for this medication, but the two most common I probably see, I would say number one is Lotrimin, and I do see Miselex, that name thrown around a bit as well. So those are probably the two most common brand names there. What is this medication used for? So it can be used for a variety of things. Over the counter, most common things I see it used for are athlete's foot, ringworm, and potentially jock itch as well. So those are all different fungal infections caused by Tinea species. And I'll talk a little bit about that coming up here. It can be used for other infections as well, other fungal infections as well, so candidiasis infections. So we do have oral candidiasis as well as vaginal candidiasis too. So few different things this medication used for, and because it's used for a few different things, we ultimately have a bunch of different dosage forms as well with clotrimazole, which I'll get into a little bit as well. First, let's mention the mechanism of action. So this binds up phospholipids in the fungal cell membrane. This changes that cell wall permeability, and that can basically allow the intracellular components and elements to essentially leave the cell. If that permeability becomes too great, where things can get across that cell wall, obviously that can lead ultimately to the destruction of the fungus. All right, so let's talk a little bit about dosage forms, and I'll start with oral candidiasis. So oral candidiasis is a fungal infection of the mouth. So obviously I mentioned the word oral there. That's meaning mouth. Essentially, it's an overgrowth of yeast, and this can be treated with oral clotrimazole troche. So if you've never heard of a troche before, troche is a dosage form. It's essentially like a lozenge cough drop type of feel, and it's designed to dissolve slowly in the mouth, and it's medicated, obviously. And so that's meant to kind of hang around, stay there, and actively treat that fungal infection with the clotrimazole. So it is a bit of a pain as far as patient adherence goes and administration. Clotrimazole troche has 10 milligrams, dissolves slowly, 5 times daily for 7 to 14 days. So that's kind of the treatment regimen if we're using it for oral candidiasis. So that antifungal activity, as that medication is kind of dissolving, sitting there, it lasts for a few hours. So that makes sense why we need to dose that medication so frequently. Now, there are suppressive ways to use this medication if somebody's immunocompromised or something, and we're using it kind of longer term. So you may see it dosed less frequently in those rare cases, but in all honesty, it's been a long, long time since I've seen it used in that way. All right, so let's talk a little bit about some of the tinea infections. So we've got tinea pedis, that's athlete's foot. Ringworm is another type of tinea. Jock itch is another type of tinea infections, but they all can be treated with clotrimazole, or clotrimazole has some proven efficacy against those various tinea species. So one of the challenge with many fungal infections is they take a little while to treat. So fungal infections can be a little bit challenging. So for these tinea infections specifically on the skin. 1 to 4 weeks of treatment, and it's going to be twice daily application being the recommended dosing frequency. Okay, and for some of these, especially like athlete's foots, can kind of be a bugger for sure to kind of get rid of. It's actually recommended most of the time to treat for another week after resolution, just to ensure that that infection is gone. Because again, those fungal infections are kind of slow growing, tough to get rid of, and they can come back a little bit on you too. So again, longer treatment periods definitely can be tough for patients to kind of stick with it. But obviously we don't want it to progress further, and hopefully the patient is motivated to get rid of it the first time. Let's go back to candidiasis, and there's another type of infection besides oral candidiasis. We can have vaginal candidiasis. So clotrimazole can be used for this. Topical or vaginal administration of clotrimazole. Typically, we're going to use this medication only in uncomplicated situations. Now, there may be rare cases where we may use it for more complicated situations if we can't use other medications or something for some reason that treat this type of infection. Then we may have no other choice. But again, more uncomplicated. So that's generally your younger, healthier patients where it's not a recurring infection. So again, not pregnant, no immunosuppression, kind of a random infection. Clotrimazole could be considered here. With that said, there's a couple of different courses. There's a 3-day course that's generally with a higher percentage of medication. So that's the 2%. 7 days, that's the 1% medication. So that kind of duration of therapy and what we do there can vary depending upon the clinical circumstance. In general, if we're using this in pregnancy or in patients who are pregnant, we're going to probably want to do a longer course of treatment just to make sure that that's effective enough and gets rid of that infection. So let's talk about some of the dosage forms here. I'll just kind of list some of them off. So we've got kind of a topical cream. We've got vaginal cream. There's lotion. There's ointment. There's also solution. Most of these are going to be in the 1 to 2% concentration. That's probably what you're going to see most often as far as that percentage and strength with this medication. Important, obviously, with any topical medication, it's for external use only. So, topical cream, we don't want to take that orally, for example. Avoid contact with the eyes. I think that's kind of common sense there. And again, if patients aren't seeing improvement, especially with athlete's foot, jock itch, those type of things within, a week or so, maybe 2 weeks, probably going to want to have a provider look at that and see if there's something different that we should do if the patient's not responding. With some self-medication and like vulvovaginal candidiasis, make sure we, discuss this with a healthcare provider, particularly if, patients haven't had this type of infection before. We want to make sure there's nothing else going on. There's no immunosuppression. There's no, potentially coexisting sexually transmitted infection. So if there's ever kind of doubt, let's say you're a pharmacist working in a retail setting, and the patient, doesn't seem comfortable, but they're guessing, as to what the infection is, that's probably a patient that should be referred on and make sure that we've got the actual diagnosis right before, trying this over-the-counter medication there. All right, adverse effect profile. So obviously topical irritation, any type of medication used topically can cause some redness, irritation, those type of things. Oral troche can have some irritation. Some patients may not like kind of the taste and that type of thing. It may cause a little bit of upset stomach too. So that can certainly happen. What we're tracking, what we're monitoring, there's no real labs associated with monitoring for the safety of using topical clotrimazole. We're probably just looking at that resolution of the infection. Is the patient getting better? Does it look like the treatment regimen's working? Onset of action, again, for fungal infection, a few days, maybe up to a week or two before we, kind of start seeing some of that improvement as well. So, again, can kind of vary based upon the infection, but maybe a little bit slower onset of action, let's say, compared to, an antibiotic for an ear infection, for example. A little bit, typically, fungal infections are going to respond more slowly than something like that. Systemic absorption is relatively low. So through the skin for clotrimazole absorption is basically negligible. Hardly anything at all is going to get through the skin. Intravaginal, maybe a little bit more, slightly more, but generally has been proven fairly safe and lower risk for pregnancy and is a potential option in that setting most of the time. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like ambulatory care, NAPLEX, pharmacotherapy, PCM, TMS, geriatric exam, go check out meded101.com/store. In addition to pharmacist board certification, we got tons of stuff for nurses, pharmacy technicians, med students, case studies, clinical situations, books, all sorts of good stuff there. You can directly support this podcast by purchasing products through meded101.com/store. I greatly appreciate all your support. Again, go check that out. Support the sponsor, meded101.com/store. All right, wrapping up with drug interactions, and I might throw in some drug disease state interactions here as well. So, drug interaction standpoint, we don't really have a ton of risk when we use a topical agent that's pretty minimally absorbed. What I will call out, though, and what I've seen from a prescribing cascade standpoint is there are certain medications that can increase the risk for fungal infections and fungal growth. So patients who have frequent antibiotic use, that can increase the risk of vaginal candidiasis, for example. So can kind of change that normal flora and potentially make it more likely for fungal infections to be able to grow and exacerbate. Also, think about thrush, so oral candidiasis. So we recommend rinsing, spitting after the use of inhaled corticosteroids. That's because they can potentially increase that risk for thrush, oral candidiasis overgrowth. So definitely pay attention to that. And probably the most concerning cases are if you've got a patient that you see being treated with clotrimazole frequently, for example, for thrush or for a vaginal candidiasis, pay attention to that. And then we can go back, look at their medication list, make sure that we aren't causing more harm with some of the meds that we're using. And maybe we're using an immunosuppressant or an antibiotic frequently or whatever the case may be, that's causing or contributing this issue. And then the last thing I'll mention is kind of the drug disease state interactions. So pay attention to, again, patients who have frequent fungal infections. That may be a sign of immunosuppression or some other medical condition that's causing or contributing to this issue. So again, fungal infections aren't insanely common. So if you get a patient that's having recurrent ones, particularly candidiasis type infections, that's definitely something to be aware of. And if it's more than one and it's happening frequently, multiple times per year or something, definitely keep your flags up in your head, saying, hey, is something going on with this patient and what's happening, and is there something else we should look at that may be causing or contributing to this recurrent issue. All right, well, that's going to wrap up the podcast for today. Thank you so much for listening. Do me a huge favor, leave a rating and review on iTunes or Spotify or whatever platform you're listening on. I greatly appreciate that. Please support the sponsor, meded101.com/store. Tons of educational resources there for all different type of folks trying to learn pharmacology. So go check that out, support the sponsor there. Questions, comments, feel free to reach out to me, mededucation101@gmail.com, or you can connect with me on LinkedIn as well. Eric Christensen, PharmD, BCPS, BCGP. Thank you so much for listening. Take care, and I hope you have a great rest of your day.